The median age of our gastric GE junction patients was about 43 years of age, and our pancreas cancer patients about 62 years of age. They're a very heterogeneous population, a good division between male and female, and then many different backgrounds culturally. These patients had all been through usually about 3 or more lines of prior therapy before getting CAR T and had multiple comorbidities. Many of these patients were on TPN, weren't eating orally, had gastric venting tubes or even diversions. Many of them had peritoneal mets or other type of metastatic disease. And they had all been through various taxane, platinum, 5-FU, and even some immunotherapy prior to their treatment. And with these patients, importantly, we had no dose-limiting toxicities or treatment-related deaths. There was no grade 3 CRS. Most of the CRS we saw was grade 1, grade 2, and no acute GI toxicities that were noted. No GI bleeds, gastritis, pancreatitis, anything like that. We had one patient who had a complete response in the gastric cancer arm. Our objective response rate in that arm was about 60%. In the pancreas patients, we had stable disease seen in about 60%. So that's off chemo with stable disease. We hadn't yet met our duration of response and progression-free survival, but we ended up getting a disease control rate of about 83% at our second dose level. And we had looked into the kind of substratification of these patients to look for any specific markers that would show efficacy or not. And truthfully, these patients, a small group, had a lot of different backgrounds. So there was nothing that we really put our finger on except for the claudin 18.2 expression. Some had peritoneal mets, some had previous anti-PD-L1, PD-1 therapy. There was a mixture of intestinal versus diffuse pathology. So all of these patients really seemed to respond.